This is skill 6, filling a prescription with a time limit of 5 minutes. The first step in filling a prescription is to obtain the prescription order. The second step is to review the prescription for legality and correctness. This includes verifying the name on the prescription by asking the patient, verifying that the prescription was presented within 1 year of being written, and verifying the address of the patient. Step 3 is to review the original medication order with the judge and be sure that the correct dosage form is included on the prescription.
Is this supposed to be tablets?
All right. This prescription should be a tablet, and also that the correct strength is included on the prescription.
This is for 50 milligrams, is that correct?
50 milligrams, correct. Step 4 is to determine if a generic substitution is allowed based on the information on the prescription.
This prescription has okay for generic substitution.
So we're okay to substitute. Step 5 is to use an alcohol-based hand sanitizer for hand hygiene. Step 6 is to obtain the correct medication that you're going to use to fill the prescription. Step 8 on your guideline is to check the medication for its expiration date. Step 9 is to calculate the number of tablets or capsules you're going to need to dispense based on the prescription you've been given.
The quantity is number 30.
Step 10 is to use the counting tray and spatula to count the needed number of tablets or capsules for the prescription. It's very important that you don't touch medications directly with your hands and that you use the counting tray and spatula to dispense the medication. You recount the tablets in step 11 to ensure that the correct number will be dispensed to the patient. Step 12, you obtain the correct container, the correct type and shape for the prescription being dispensed. Once the medication is placed in the correct container, you'll be selecting the correct prescription label from an assortment of labels that will be provided to you at the competitive event. You look at the labels and recheck the directions and the drug strength. And that is fastened to the container along with any auxiliary labels in step 14 that might be indicated to give additional instructions, precautions, or warnings to the patient. Once everything is labeled, you submit your prescription to the pharmacist, who will be the judge for the final check.